Norovirus training for environmental cleaning staff. Norovirus is the name of the virus that causes the frequently occurring stomach bug illness. Sometimes people call it the stomach flu, although it is not related to the influenza flu virus, which usually causes respiratory illnesses. Norovirus is a highly contagious virus that causes gastroenteritis, which is an inflammation of the stomach and the small and large intestines. In fact, norovirus is the most common cause of acute stomach and intestinal infections in the United States. Each year, about 21 million cases occur in this country. It is most often seen in schools, daycare settings, on cruise ships, and in long-term healthcare facilities. The virus survives on surfaces for days to weeks if not removed by proper cleaning and disinfection processes. You can become infected with norovirus by accidentally getting stool or vomit from infected people in your mouth. This usually happens by eating food or drinking liquids that are contaminated with norovirus, touching surfaces or objects contaminated with norovirus, and then putting your fingers in your mouth, or having contact with someone who is infected with norovirus. There is no vaccine to prevent norovirus infection or drug to treat people who are sick with it. Individuals who are ill from norovirus should drink plenty of liquids to prevent fluid loss and dehydration. When a person is infected with norovirus, they won't likely have any signs of illness for usually 18 to 48 hours, but actually become contagious to others several hours before they begin to feel ill. Signs and symptoms of norovirus include nausea, vomiting, diarrhea, abdominal cramps, chills, fever, and a general feeling of being sick. In a healthcare facility, individuals with norovirus should be placed in contact precautions, which require the use of gowns and gloves for clinical care. If you are a healthcare worker who has a norovirus infection, you should inform your supervisor of your symptoms when you first become ill. You should not return to work until you have been free from these symptoms for a minimum of 48 hours. After ill people recover from norovirus, they are still shedding virus in their stool for a couple of weeks, and can still spread the germs if they don't perform adequate hand washing after using the restroom. During the norovirus illness, a person will have billions of virus particles passed from their body in their vomit and diarrhea stool. Norovirus is very infective. It only takes 18 virus particles out of the billions to cause the next person to become ill with the virus infection. So, you can see how easily norovirus can be spread. The ease of transmission, the low infective dose, the short incubation period, and the fact that the virus is so environmentally hardy make this kind of outbreak a tough one to control. In a healthcare facility, infection control staff initiates intensified norovirus interventions typically when 2 or more cases occur within a short period of time. As members of the environmental cleaning team, this video is intended to assist you in your training about the special cleaning and disinfection practices that are recommended for dealing with a norovirus outbreak in your healthcare setting. Swift implementation of aggressive infection control measures is necessary until the outbreak is under control. Following correct steps is essential to controlling the spread and keeping yourself well. These steps include strictly enforcing the appropriate use of personal protective equipment. This includes the proper wearing of gloves and gowns. This also includes the wearing of a face mask when cleaning up vomit or working near vomiting individuals. Remove vomit and diarrhea right away with absorbent disposable paper towels. Then wash the surface with soapy water, rinse, and follow with the application of the norovirus-approved disinfectant. Educate everyone to follow strict hand-washing practices using soap and water, and monitor hand-washing compliance. Alcohol hand-cleaning products are ineffective on norovirus, so soap and water is the recommended practice during times of outbreaks. An initial intensive deep cleaning and disinfection of bathrooms and frequently touched surfaces is recommended. Also, during the outbreak period, you should increase the cleaning and disinfection of the general patient and public areas to a minimum of 2 times per day. The patient rooms and restroom cleaning and disinfection should be increased to 3 times per day, paying special attention to the frequently touched surfaces. Let's look closer at the cleaning and disinfection process you should follow during norovirus outbreaks. Cleaning refers to the physical removal of visible dirt, dust, and organic matter. Disinfection, on the other hand, is the inactivation of disease-producing germs. Surfaces must be cleaned before they can be properly disinfected. Healthcare facilities often use an EPA-registered disinfectant product that is a combination cleaner-disinfectant. These types of products allow the cleaning and disinfection process to be done at the same time as a one-step application process. But not all EPA-registered hospital disinfectants are effective for inactivating norovirus germs. When cleaning and disinfecting during a norovirus outbreak, it is important that the disinfectant being used has a label claim for norovirus coverage. For facilities using a combination cleaner-disinfectant product approved for norovirus coverage, you may perform this cleaning disinfection process using the one-step method according to the manufacturer's directions. For facilities choosing to use a bleach solution as their disinfectant during a norovirus outbreak, the two-step method included next should be followed, since bleach is a disinfectant only and not a detergent or cleaner. Begin by performing hand hygiene and applying the appropriate PPE. For the first cleaning step, you will be physically removing the germs from the environmental surface in this step. During times of intensified norovirus outbreak cleaning, you should use disposable paper towels to absorb the vomit or diarrhea as needed. After absorbing the bulk of the liquid and discarding, you would then use a soap and water type of detergent solution to clean the surface, applying friction. Once you have completed this step and carefully discarded the contaminated cloths into the appropriate container, rinse the surface using water and dry. Next, perform the disinfection step. This second step of the cleaning disinfection process is intended to kill any remaining germs on the cleaned surfaces by applying a bleach solution. Disinfectant solutions should be applied to the surface either by a saturated cloth, towel, or a pour spout type of container. Make sure the surface is wet with the disinfectant liquid and remains damp on the surface for the required contact time, according to the label directions. Disinfectants should never be aerosolized by spraying from a container onto healthcare surfaces. When using a bleach solution to disinfect, the following direction should be followed for preparing. The solution should be mixed fresh daily, and never mixed with other cleaners or chemicals. The bleach solution should remain on the surface you are disinfecting for at least 5 minutes. Rinse off with water after 5 minutes if it is considered a food surface or one that would have contact with someone's mouth. The recommended amount of bleach is 1 cup per gallon of water if it is the 5.25% bleach concentrate. If using the more concentrated bleach that is available, you would use 3/4 of a cup of bleach per gallon of water. General healthcare cleaning principles should continue to be followed during the intensified intervention time. These include always beginning with the highest surfaces and moving from high to lowest. You should start with the cleanest areas and move toward the dirtiest. These two practices will assist you in preventing the cross-contamination that may occur if you do not follow these healthcare cleaning basics. Also, you want to be sure that you are giving particular attention to the frequently touched surfaces in clinical care areas, such as commodes, toilets, handrails, bed rails, computer keyboards and mouse, faucets, light switches, and doorknobs. For carpet and upholstery that has been contaminated with vomit or diarrhea, you should first use absorbent material on the liquid residue. If you use kitty litter or other similar absorbent material, do not use a vacuum cleaner to collect it once it is contaminated. Norovirus germs may be unknowingly spread around the environment if a vacuum cleaner is used. Instead, remove the loose absorbent material by collecting it into a cleanable dustpan using a disposable piece of cardboard or other similar method, and discard in appropriate receptacle. If clothing or other fabrics are affected, keep the following information in mind. If you are using a clothes washer and dryer in your facility to launder clothing from patients with norovirus symptoms, take care to not spread the virus during the process. Be sure to follow basic infection control prevention practices, including hand washing and proper use of PPE. You should use detergent, hot water, and bleach, if it is allowed for the fabric, during the long cycle, followed by drying in the clothes dryer. Be sure to properly clean and decontaminate the washing machine, including the lid and knobs after use. Remember, protect yourself from becoming exposed to the norovirus germs by always performing hand hygiene with soap and water for at least 15 seconds before applying and after removing gloves, before you eat, after you use the restroom, and anytime your hands or gloves may be visibly contaminated. Keep others safe by not working when you are ill with norovirus for a minimum of 48 hours or according to your facility's policy after your symptoms end. By following the instructions included in this video, you will be able to reduce the risk of spreading norovirus germs in your facility during times of intensified interventions. Environmental cleaning staff members are a major key in preventing ongoing transmission of the norovirus germs during times of outbreaks in healthcare settings. Because of your specialized training and your dedication to performing the best practices possible, the healthcare environment is a safer place for everyone. As an important member of the healthcare team, thank you for what you do every day to provide the safest environment possible.